Okay, we are going to continue our discussion of helminths, now focusing on two categories of platyhelminths that are cestodes or tapeworms and trematodes or flukes. Contrary to the episode on nematodes that I kind of deeply discussed the basis of pathophysiologic understanding with the purpose of addressing the clinical diagnosis and treatment options, here we have a little bit simpler, less pathophysiological approach, but we have this list that we have to follow. Again, following the recommended approach, the best way is to understand the general rules of diagnosis and treatment. Again, for both these categories of platyhelminths, cestodes, and trematodes, the treatment of choice is praziquantel. There are exceptions to that. Again, all of them the adult worm stays in the small intestine, with a couple exceptions, especially in the flukes category. And then most of them are diagnosed by stool for ova and parasite, again with a couple exceptions. Again, we have intestinal and tissue cestodes, depending on what has been the infective form. And please pay attention to the words infective form and infection. If the infective form was the larva, the infection in the host, in this case human host, is caused by the adult worm. If the infective form is the egg, the human infection is mediated by the larva, and it's called larval infection or tissue cestode infection. Now, focusing on the intestinal cestodes, I would like you to again follow our approach of knowing the epidemiologic data and risk factors, followed by one or two specific findings, either clinically or in laboratory, about each one of them. However, I would like you to again review the common or general clinical symptoms of helminth infestation, which are abdominal pain, diarrhea, obstructive symptoms, or in the case of cestodes, presence of proglottids in feces. What is the precise mode of transmission for intestinal tapeworms? Ingestion of larva that contains the cyst. This larva contained within the cyst is called Cystic Sarcosis. So ingestion of Cystic Sarcosis causes intestinal cestode infection. Ingestion of cestodes eggs cause Cystic Sarcosis, which is the tissue form of cestode infestation or infection. Now, what is the most important factor regarding differentiation of different intestinal cestodes clinically? The risk factor, including the type of food that transmits them. So can you discuss that? If the patient is found to have proglottids and non-specific abdominal symptoms after consumption of undercooked beef, it is Taenia saginata. If it was associated with ingestion of undercooked pork, it is Taenia solium. And if it was associated with ingestion of undercooked fish, it is Diphylobothrium latum or broadfish tapeworm. There are a couple less common forms of intestinal cestodes that include Diphylobothrium caninum or dog tapeworm, as well as dwarf tapeworm or Hymenolapis nana. One of them has a very peculiar mode of transmission, and that is eating larvae within the dog fleas as the mode of transmission for Diphylobothrium caninum. Now, in addition to the type of the food associated with these cestode infections, what other epidemiologic data can help? Well, you can assume in countries in which they consume a lot of raw fish, who may have Diphylobothrium latum. In countries that they do not consume pork, mostly the Muslim countries, we will not have Taenia solium or Cystic Sarcosis caused by it. And otherwise, it will be Taenia saginata. Now, regarding Diphylobothrium latum, couple important factors could help the diagnosis. What are they? One is contrary to the other intestinal cestodes, eggs in the feces, not just proglottids, but the presence of eggs in the feces could also help the diagnosis, especially the special shape of the Diphylobothrium eggs, which is defined as operculated eggs. Also, presence of B12 deficiency. Now, if you are asked what are the helminths that could be transmitted by consumption of water containing copepods, and knowing that copepods are these tiny microscopic crustaceans such as planktons, remember this is a second mode of transmission for Diphylobothrium latum. Also remember, copepod containing water was a mode of transmission for guinea worm, Dracunculus medinensis. Okay, now let's discuss the larval infection of cestodes. That's the tissue infection by the larva of cestodes in two cases. You have a patient with new onset neurologic symptoms such as seizure, focal neurologic deficits, or even manifestations of ICP elevation from a pig farm region or pig raising region. What is the most likely diagnosis? This is Cystic Sarcosis. More specifically, Neurocystic Sarcosis. Now, what other tissues could be affected by Cystic Sarcosis? Remember, in addition to brain or eyes, many organs such as liver, lung, muscle could also be affected by Cystic Sarcosis. Now, what is the diagnosis for Cystic Sarcosis? Brain imaging, especially CT and MRI, as well as serology. And what is the treatment for this patient? Surgical treatment, albendazole or praziquantel, and corticosteroids. In other words, if the Cystic Sarcosis involves an organ that amenable to surgical removal, we attempt surgery. For all patients, we also attempt albendazole, not praziquantel, as the first line treatment. However, praziquantel is the alternative, and corticosteroids are also to be provided, especially for the cases of Neurocystic Sarcosis. Now, next case is a patient from a ship raising area, especially in high or northern latitudes, that reports contact with canids, including dogs, foxes. And whenever you hear such term, always remember there's a possibility of contact also with the canid's feces. The patient may have no symptoms and have some incidental finding of some cyst in the imaging, or may have special symptoms of the organs involved, such as hepatomegaly, headache, etc. I assume you know where I'm heading. What's this? This is Hydatid cyst disease caused by Ecchinococcus granulosus, if it is single cyst, or Ecchinococcus multilocularis, especially seen in the lungs with multiple cysts. True or false for this last patient? The first line in the treatment is aspiration of the cyst. That is false. Even though aspiration could be both diagnostic and could provide potential theoretical treatment option, we should remember that aspiration increases the risk of release of proglottids into body cavities and causing anaphylactic shock. Therefore, the treatment includes surgical removal together with albendazole. And again, diagnosis similar to Cystic Sarcosis is made by imaging and serology. Okay, so this is our Cestodes algorithm with a couple high yield cases. Perhaps the most high yield in the entire Helminth section is the Cystic Sarcosis and its important differential diagnosis. We will discuss them when we approach differentials of the brain lesions, conditions such as CNS lymphoma and toxoplasmosis, etc. One point I would like to remember is Cystic Sarcosis infection, especially Neurocystic Sarcosis, does not require the host to be immunocompromised, contrary to primary CNS lymphoma or toxoplasmosis or brain CMV infection, for example. That said, let's move to our final group of helminths, which are flukes or trematodes. Again, we have intestinal and tissue trematodes. Now, one very important point that I believe would simplify understanding of Flukes or Trematodes infection is that we are dealing with water-based transmission. And why is it so? It's because the eggs of these pathogens hatch in the water. Again, I don't want you to focus too much on the names. The life form that comes out of the eggs of these bugs is called Miracidia. This enters the first intermediate host, the most important intermediate host for the flukes, which is freshwater snail. The next step enters humans as definitive host, and that stage is called Cercaria if it is penetrating the skin, or metacercaria if it is the cercarial form that's encysted and then consumed either by consumption of some water-based food product. It could be aquatic vegetables, it could be crustaceans such as crab, or it could be just fish. Another point is, contrary to all other types of helminths we have discussed, we have just one form of intestinal fluke, and that is actually called giant intestinal fluke, the Fasciolopsis buscae. It's transmitted by eating aquatic vegetables such as watercress. Now, an important question or challenge is when to have suspicion for fluke infections, for trematode infections. I would like you to always remember a patient with non-specific GI symptoms, organomegaly including hepatomegaly or hepatosplenomegaly, but also lung and urinary tract symptoms, as well as some sort of exposure to water products, water foods, such as aquatic vegetables and watercress, fish, crab, etc. They usually need to provide maybe one lab-based finding, such as either eosinophilia or something in the bronchoalveolar lavage or hematuria or the shape of the eggs. So let's review them. But have this in the back of your mind that patients from the regions in which consumption of aquatic vegetables or raw freshwater products, either fish or crab, is common and now have non-specific GI symptoms, special liver symptoms, or lung symptoms are the typical cases for flukes. Now, on top of this generality, let's discuss the little details for each category. First case, we have a patient with hepatomegaly, cholangitis or jaundice, and or hepatitis-like symptoms, provides a history of eating aquatic vegetables such as watercress, or comes from sheep raising area. What is the diagnosis? This is the typical case of Fasciola hepatica or sheep liver fluke. Now, you may be confused about the consumption of aquatic vegetables. So what are the two types of flukes that could be transmitted by consumption of watercress or other aquatic vegetables? Always remember either Fasciolopsis buscae or Fasciola hepatica itself. How do we differentiate these two? The Fasciolopsis buscae is purely intestinal fluke. We do not expect any type of hepatic signs or symptoms. We do not expect hepatomegaly or cholestatic or hepatitic symptoms in Fasciolopsis buscae or intestinal fluke. Okay. Next, we have a patient from Southeast Asia with the same liver-based symptoms such as hepatomegaly, cholestatic symptoms, or hepatitic symptoms, who provides a history of freshwater fish consumption. What is the diagnosis now? Now, this is referred to as Clonorchis Sinensis or Chinese liver fluke. Now, how do we differentiate these two liver flukes from one another? Well, one of them is associated with aquatic vegetable or patient from sheep raising areas. The other is associated with fish. Now, you may wonder if we are dealing with the freshwater snail and humans as the intermediate and definitive host, what's the deal with consumption of fish? Well, remember in the case of Clonorysis Sinensis and the other one, which is the lung fluke, we are dealing with a second intermediate host. And in the case of Clonorysis, it is freshwater fish. So let's talk about the lung fluke. What's its name and manifestations? Its name is Paragonimus westermanni, causing a disease called Paragonomysis, and is also called lung fluke. Now, what is the typical case of Paragonomysis? We are dealing with a patient who has eaten large crustacean, not microscopic crustacean, but large crustaceans such as crab or crayfish, and now has lung symptoms. It could be pleurisy, it could be hemoptysis, it could be cough, and it's kind of very specific or unique, I should call it. You have a patient who has eaten crab and now has brown sputum. There are not too many conditions that are in our differential diagnosis list. The first should be Paragonomyces. Now, what specific lab findings you are expecting in this patient? Remember, in the case of helminths in general, we talked about it in nematodes. Whenever we have any type of life cycle of these helminths that involves lung or involves in entry of a form of the parasite into the bloodstream or lung, we are having high eosinophilia. And so that's the case specifically among all flukes. It's the case specifically with Paragonomyces, Paragonimus westermanni. Remember diseases or helminths transmitted by crustaceans? Yes, the microscopic crustaceans, the copepods, transmit Diphylobothrium latem and guinea worm. The large crustaceans such as crab and crayfish transmit the Paragonimus westermanni. Okay, now we are going to discuss the meat and juice of trematodes, that is blood flukes, the schistosomes. What differs in terms of transmission of the infective form in schistosomes or blood flukes versus other flukes? Well, while consumption of some sort of water-based products containing metacercaria or cercaria is the means of transmission for the other flukes we discussed so far, penetration of bare skin by the cercarial form, for example, exposure to soil that contains the freshwater snail and therefore contains this larval form, the cercarial forms, is the means of transmission for blood flukes. Next, approaching blood flukes, and we are talking about a patient with symptoms of blood fluke after walking bare feet in these areas that are suspicious of freshwater snail infection. Presence of freshwater snail. What are the important factors to bear in mind? One factor to bear in mind is one type of blood fluke is associated with urinary symptoms, and the other two types of blood flukes are associated with organomegaly, melena, hemoptysis, and all symptoms associated with vascular involvement in the mesenteric circulation. The second important point is paying very close attention to the shape of eggs in addition to the clinical manifestations that will help differentiating the blood flukes. Now, here's that specific place I want to just bridge to pathophysiology. What vascular plexuses are affected by each type of blood flukes? First of all, remember that larva enters the blood and the adult form resides within these vascular plexuses. Now, if the adult fluke is residing within the superior mesenteric vessels, it is Schistosoma japonicum. If it is residing in the inferior mesenteric vessels, it is most likely Schistosoma mansoni, but it could also be Schistosoma japonicum. But again, Schistosoma mansoni cannot be found in the superior mesenteric vessels. Now, if it is found in the bladder plexus vasculature, it is Schistosoma hematobium. Also remember, the basis of pathogenesis and pathology is not presence of the worm itself, but the eggs in these venous plexuses that is irritating and causes inflammatory response. So, what are the cases of blood flukes? Case number 1, we have a patient with history of exposure to snail containing water or soil, and the patient now has signs and symptoms of portal hypertension, such as esophageal varices, also hepatosplenomegaly, hemoptysis, melena, and nausea and vomiting are other possible findings. What's the next step for diagnosis of this patient? Stool for ova and parasite. Now, if you're told that stool assessment for ova and parasite shows eggs with small lateral spine, what is the location of the adult worm? Okay, remember, presence of small lateral spine in a patient with symptoms of blood fluke is diagnostic for Schistosoma japonicum, and the adult worm stays in the small intestine. So remember the small things, small lateral spine, small japonicum, lateral spine, and staying in the small intestine. Now, if the stool for ova and parasite shows large lateral spine, where is the location of our blood fluke? This is staying in the large intestine and liver vessels, and this is Schistosoma mansoni. So remember, large intestine, large lateral spine, small intestine, small lateral spine. Finally, we have another patient with exposure to freshwater snails, such as walking and hiking bare feet in these areas. And patient complains of hematuria acutely, or patient complains of urinary tract infection. You may be asked, what is the long-term feared complication of his condition? Remember, this is Schistosoma hematobium, and the feared long-term complication is bladder cancer. Now, if you are asked what's the shape of spine or the location of the spine on the eggs of Schistosoma hematobium, remember, it has terminal spine and not lateral spine. True or false? Stool assessment for ova and parasite is the next step for the diagnosis of Schistosoma hematobium. That's false. Again, the patient has urinary symptoms. Yeah, so urine for ova and parasite should be evaluated. What's the alternative means for the diagnosis? Either urinary tract ultrasound or intravenous pyelogram that shows feeling defect within the bladder, or hydronephrosis is the alternative means for diagnosis of Schistosoma hematobium. Now, in general, compare and contrast the two types of bladder cancer in terms of their epidemiologic regional association. Remember, given the fact that Schistosoma hematobium is the major risk factor in the countries in which schistosomes are endemic, such as Egypt, for example, we have the type of bladder cancer associated with it. And what's the type? That's a squamous cell carcinoma of the bladder. However, in developing countries, that's the case. However, in the developed countries, urothelial or transitional cell type of bladder cancer is the dominant type of bladder cancer. Finally, what is the treatment for all flukes or trematodes, and what's the exception? Similar to cestodes, flukes are also treated with praziquantel. The exception is Fasciola, that's treated by triclabendazole. Couple final questions about the flukes, about the shape of the eggs. While we mentioned the schistosomes have this spine either laterally in the case of Japonicum and Mansoni, or the terminal spine in the case of Schistosoma hematobium, what's the shape of egg for the other flukes? Remember, fasciolas, either Fasciolopsis busci or Fasciola hepatica, are said to have ellipsoid or elliptical eggs, while the two others, the Clonorysis Sinensis and Paragonimus vestermini, are said to have operculated eggs. Now, do you remember what other helminth has operculated eggs? That is Diphylobothrium latem. So, Diphylobothrium latem, Clonorysis sinensis, Paragonimus vestermini have operculated eggs. Fasciolas have ellipsoid eggs, and schistosomes have eggs with terminal or lateral spine. So now let's review the shape of eggs for a couple other parasites with a couple other more differential diagnosis questions to end the entire helminth discussion. How about that? Do you remember what helminth produces barrel-shaped eggs? Yes, that was Trichuris trichiura or whipworm. We discussed it in the nematodes section. Do you remember what helminths produce ovoid eggs? Remember these ones with the lateral terminal spine, the schistosomes, have ovoid eggs, but also never forget Ascaris lumbricoides. Do you remember what pathogens or helminths, let's forget about pathogens, what helminths are transmitted by consumption of products from water, aquatic products and freshwater food? Well, we mentioned all non-schistosome flukes, including Fasciolopsis buscae and Fasciola hepatica by consumption of aquatic vegetables. And we mentioned Diphylobothrium latum among the cestodes, as well as Clonorysis sinensis among our flukes to be transmitted by freshwater fish. And we mentioned large crustaceans such as crab and crayfish are the means of transmission for Paragonomysis westermani. Never forget Ecchinococcus. That's also another one of our nematodes that's transmitted by freshwater fish. Remember any gram-negative rod associated with consumption of seafood products? Yes, almost all species of Vibrio. Finally, do you remember what was the best treatment approach for all nematodes and the exception to that? Yes, we treat nematodes with bendazoles such as albendazole. The exception was Strongyloides or Onchocerca, which we treat with ivermectin as the drug of choice. And thank you. This finishes our discussion of helminths.